Minister, Public Health have introduced many measures in terms of COVID since the start of this outbreak, and I think it has to be said that many were called for by medical professionals probably before public health care or even government reacted. Masks would be one case. I think the early adoption of test and trace, and certainly mandatory hotel quarantine was being asked for a considerable length of time. And I'm glad, as other speakers have noted in the House, and that you have also noted, that it has had a significant effect in terms of protecting us from incoming variants. And certainly we're in a very possibly tough position now, looking across the water in terms of where the progression of the Indian variant disease is going. But I think there is logic has to be questioned to a degree too, in terms of how we impose mandatory hotel quarantine in the Republic when people are able to sidestep it by coming in through Belfast Airport. And it has been said many times that we need to get a whole island approach in terms of the island's defence against incoming variants. I think mandatory quarantine has put significant pressure, obviously, on international travel. That was the idea. But there's no doubt it has also probably damaged future travel connections, and we have to look to see how soon we can begin to rebuild these. And also it has had some effect on the travel of people who work in the foreign direct investment sector coming in and out of the country. And that again is a cost on the economy. It has worked, but anomalies exist, as we said. And could I point out just one, which is that people from the Emirates, I think was mentioned earlier by Deputy Kostic, who may wish to travel into Ireland for necessary functions, have taken a vaccine approved by the World Health Organization, but not approved by the EMA. And I have a family, 2 parents with 2 disabled children. And how are we going to look after them in terms of 2 weeks of quarantine? And they have to come home. That's a very significant case, Minister, and they're asking rightfully the question. They're vaccinated, but yet we're not recognising it as recognised by the WHO. So I think we have to recognise vaccination centres from overseas, and how we're going to verify future travel and what technology is being considered, Minister, because we know we're talking about hopefully opening up the economy soon, potentially, and it suggests to me that we're going to have very, very significant technology difficulties in terms of trying to manage that, in terms of European and worldwide vaccination certificates. Can I say also, it has been mentioned here by a number of deputies, this issue of the people who are awaiting second doses of either Pfizer or AstraZeneca, and there is considerable, I would say, disquiet amongst a number of people with this talk of an Indian variant. I'm sure you've seen that the UK are making moves in terms of reducing the timelines, Minister, and I would ask again that NEFIT would look at this, particularly in terms of the transmission potential of the Indian variant to people who have only had 1 dose of vaccine. Something else, Minister, which you know is a bugbear of mine and many others, is the ongoing situation with antigen testing. And we've had the Ferguson report, and I wonder, would you care to comment? Professor Ferguson reported to committee just a couple of weeks ago that the only department who had engaged with him subsequent to his report was the Department of Higher Education and Minister Harris. And I'm just wondering, has that situation changed? Would you be aware whether it has, and if it has, do you know what other departments are talking to him, and potentially what testing they're considering, or pilot testing they're considering? The other thing, Minister, I think we have to keep going with, absolutely, with mandatory hotel quarantine, but I might just give you another little bit of an anecdote, which is a couple who recently returned from mandatory hotel quarantine in Portugal. And despite the fact that they were in quarantine, they were able to get out during the day quite a number of times and travel around with a degree of freedom. And I'm wondering again, could antigen testing being used for people who are in that position? I don't know how I would manage locked into a hotel room for 14 days. Coming out a couple of times a day. I think it's a very, very hard ask on people, and I think we need to, we're all the time talking about mental resilience and mental health. I think that would certainly test it for a lot of people, and again, maybe this is an area where antigens could be considered. Just to go back to aviation for the minute, Minister, and we've had a lot of talk about potentially getting onto the EU Digital Green Cert, but we have a significant amount of people now in the United States, a very pivotal tourism market for Ireland, who are now fully vaccinated. And I'm wondering, is there any model whereby Ireland could enter some agreement with US travel to get those vaccinated travellers to open up, particularly the west and the south of Ireland, all the regions that absolutely depend on tourism, and to offer these people as early as possible the opportunity to come to Ireland. I think they are going to have opportunities to book flights to Asia, to book flights to other areas outside the US, maybe to Europe, and Ireland might not be on that. There's a significant tourism kick, I think, in that, and I'm sure it's something that can be developed with just a little bit of outside-the-box thinking. Also, Minister, just on the EU Digital Green Cert, can you provide any assurance that we are going to be on this from the start? And I think the mood music at the moment is basically suggesting that we're not. And also, I think I heard you mention in the House the other day that government, or probably the department, are speaking to some technology providers to ensure that we will be able to be facilitated. But there does appear to be a significant amount of IT required in order to link into that. And can you give us just any comments about security around that, if you please? So I think just for the future, we know that we're in a position now of constant surveillance, and we need to get the vaccinations, and we are doing it. And I would congratulate you, Minister, and the department, and certainly all of the people taking part nationwide in terms of the vaccination programme. I had the benefit of getting my vaccine last week, and I have to say it was a top-class job done by everybody involved, but I was delighted to see that there were pharmacists included in the vaccination centres, and I think that we need to get as many people involved. I understand it's always a factor of vaccine supply, but I think constant vigilance is required, Minister, and I would ask you again, please, with NEFA, to have a look at the issue of aviation. A number of deputies have spoke about it here today. I know that Lufthansa, US Air, British Airways are all using antigen testing to fast-track travel, and I think surely we can be able to link in with those programmes as well. Chair.